Constipation is a defecation disorder that occurs when you have difficulty carrying out intestinal function or when the frequency of stool evacuation is less than 3 times a week. Constipation is characterized by the formation of hard and dry stools, which are difficult to expel and which prevent the intestine from being completely emptied, as well as a series of signs and symptoms such as flatulence, meteorism, bloating, and abdominal pain. Chronic constipation affects an important part of the population, estimated between 15 to 20%, with a greater incidence in females and the elderly. It is not a disease in itself, but rather the symptom of a possible intestinal disorder that requires further medical attention. But what are some natural and quick remedies against constipation? Let's go see them. Water. If we talk about natural remedies, we undoubtedly find water in the first positions, the blue gold of the planet, vital resource for the survival of man and the entire planet. Water is an essential element for the correct functioning of our organism, and in particular of the digestive system, as it stimulates intestinal activity, promotes digestion and intestinal peristalsis, that is, that series of natural intestinal movements with which food advances along the digestive tract. Dehydration is in fact one of the main causes of constipation because if the body does not receive an adequate quantity of water, it tries to recover as much as possible by absorbing it from the feces. They will thus become dry, hard, and difficult to expel, so they will struggle to move along the digestive tract, slowing down intestinal transit and digestive processes. Therefore, drinking the right amount of water daily helps to soften the stool, thus facilitating their passage within the intestine and consequently the evacuation process. The amount of water to drink is quite variable depending on individuals, as it depends on gender, age, body weight, the type of physical activity and work performed. The guidelines remind us that you should drink at least 2 liters of water a day to keep your body healthy and hydrated. Dietary fiber. Dietary fibers are a group of organic substances present in the cell wall of plants, which due to their complex chemical structure cannot be completely digested and absorbed by our stomach and small intestine. This is because they resist the degradation of digestive enzymes and therefore the action of the gastric juices of the gastrointestinal tract. Although dietary fibers do not have a specific nutritional and energetic function, they should be consumed daily due to their numerous beneficial effects on the body. The fibers act like a real brush as they clean the intestinal walls as they pass, promoting the elimination of unabsorbed food. However, it is essential to take them together with plenty of water because only in this way is their ability to retain liquids exploited and thus increase fecal mass, consequently promoting intestinal peristalsis and therefore the evacuation of feces. Dietary fiber is found mainly in fruits and vegetables, legumes, and whole grains such as rice, oats, barley, and rye. Among the fruits richest in fiber, we find apples, pears, raspberries, plums, and avocados, while among the vegetables we find artichokes, aubergines, carrots, and cabbages. Dried fruit is also an excellent source of fiber, especially walnuts, almonds, and pistachios. Experts recommend consuming at least 25-30 grams of fiber per day, a value that is difficult to achieve in Western countries. If they are therefore consumed within the recommended levels, they help prevent and combat constipation. On the contrary, however, in some patients dietary fibers can worsen constipation, so it is necessary to gradually introduce them into your diet and see how your body reacts. Alcohol. Alcohol is a substance that doesn't need much introduction. It is toxic, potentially carcinogenic, and capable of inducing addiction. Among all its many negative effects, we find that of causing constipation or worsening existing symptoms. This is because alcohol is responsible for a loss of fluids due to the inhibition of the release of vasopressin, also known as antidiuretic hormone. This increases urine production, which can lead to excessive fluid loss and dehydration, where the intestine is forced to absorb more water from the stool, consequently making it harder and more difficult to eliminate. Some people, however, after consuming alcoholic beverages may experience the opposite effect, that is, suffer from diarrhea. These reactions depend on the amount of alcohol consumed, individual tolerance, the subject's hydration status, and his state of health. It is therefore important to limit alcohol consumption as much as possible to preserve the health of the digestive system and the entire organism, reducing the risk of developing a series of pathologies that can even be fatal. Physical activity. Performing regular physical activity can help combat constipation, as movement promotes and accelerates intestinal motility. That is the ability to move ingested food along the digestive system. This decreases the time your body has to absorb the water content from your stool during the digestive process. This leads to softer and more hydrated stools, and therefore easier to expel. This beneficial effect of exercise has been attributed to stimulation of the vagus nerve or decreased blood flow in the gastrointestinal tract, resulting in the release of some important gastrointestinal enzymes and hormones. Another explanation is that stimulation of the intestine during exercise helps stool move into the rectum, thus increasing stimulation and improving the overall efficiency of the digestive system. Not only that, depending on the type of physical activity carried out, the abdominal and pelvic floor muscles are also strengthened, contributing significantly to improving intestinal function and regularity. Performing regular physical activity therefore improves the symptoms of constipation and the overall quality of life of patients. Defecation stimulus. We've all had the urge to go to the toilet at exactly the wrong time, maybe at the cinema, at work, or on the train. In order to avoid entering unfamiliar public toilets, and often not very clean either, we tend to postpone the moment of defecation until we return home. If done occasionally, it does not cause particular health consequences, but if it becomes a habit, it can cause some side effects that we saw in the video that you can find by clicking above. One of these is constipation. To prevent it or make it worse, it is important not to hold back or postpone the defecation urge, as the feces will continue to accumulate in the rectal ampulla and dehydrate. The colon will thus absorb an excessive amount of water from the stool, which will become increasingly harder and therefore difficult to eliminate. Experts therefore advise not to delay the defecation urge when it is felt, but to indulge it even if we are away from home. In conclusion, constipation is a very common disorder that can negatively affect the quality of life of those who suffer from it. However, it is a manageable and treatable condition through some changes in eating habits and the adoption of a healthy and active lifestyle, and if necessary, also resorting to the use of some specific drugs or supplements.